recording is on. Sharing screen. Go to this one. Let me know if you can see this opening slide here.
Scott, do you want to test to make sure you can get your slides up?
It says I cannot start screen while the other participant is sharing.
Here.
Okay.
We'll just, I mean, we're live right now, and we do give people time. Those of you who are already joined, we're going to give just a minute or two for everyone to get situated, get a cup of coffee, get their lunch, and we're just going to play around with our slides a little bit here. So you get a sneak preview. I'm going to stop sharing mine, and I'll introduce the panelists in a moment.
Right.
I can see it. I think we're good.
Scott, we're all showing up under your name as a panelist because of your link.
I'm Scott Kemps, but I don't
That's
look
pretty
like Scott
common.
Kemps.
That's
Are
pretty
you now
common.
seeing the video or are you still seeing?
Yeah, the
Okay,
video.
I see the video, yeah.
Can you hit play? All right, good. Yeah, it's good. Yeah, good. All right, we're good.
All right. So if you'll unshare, I'll share. Thank you. And again, those of you who joined, we're just giving everyone kind of a minute to get in the door. And it's 12:02, so let's get started. I'm Joe Fulvio with Camoplan. I'm sitting in for Will Mucker today, who is taking a day off. This is a special edition. We usually do these on Thursday, but we've decided to do this on Tuesday because this is pretty exciting. When I first saw this, I thought, well, you know, I don't have my flying car yet, but if you want proof that this really is the 21st century, you're about to see it. We have today Scott Kemps, Dr. David Battleman, and we have one other guest. Could you please introduce yourself? Me?
Me, David, that's Joe Stauffer. Hi, I'm Joe Stauffer.
Thanks. Appreciate that. And
Also known as Scott Kemps.
also known as Scott Kemps. Yeah, I have three Scott Kemps. There are three of them. So we're going to talk to all three of them today.
Well, the real Scott Kemp real stand up is really the.
Yeah, with a real Scott. That's good. That's good.
Hello, everyone.
So we're going to talk about something that's a disruptive technology. It's one of my favorite subjects. When I see something new and exciting, I love getting under the hood. And I was kind of smitten by this, anxious to get it in front of our group. First, let me cover the heretofores and notwithstandings that our lawyers have us do. We are Camoplan. We're a neutral third party. We are a custodian for self-directed IRAs and 401ks. And so the views expressed by the speakers that we invite here are their own and not ours. And we can't guarantee the accuracy of any information. Professional advisors, we always say, talk to your tax, legal, and accounting specialist whenever you consider an investment. We can't accept any liability, et cetera, et cetera. We're not accountants. We're not lawyers. We don't even play one on TV, and I didn't stay at that hotel chain. So if tax, legal, accounting, investment, or other similar assistance is required, please seek the services of a competent professional. So I'm going to unshare, and I'm going to invite one of the Scott Kemps to go ahead and put up the slide. We don't know which one it is.
It's actually the real Scott Kemp. They'll be putting up the slide.
Like
there we go.
Yeah.
Terrific.
Like what's my line? All right.
Exactly.
So today we have with us not only Scott Kemps and gentleman just introduced himself. We've got Dr. David Battleman, who's got 20 years of experience in the academia industry and management consulting. He's already had an advisory firm called True North Life Sciences. and he served as a principal in the R&D commercial strategy practice with IMS Health Holdings, which is a New York Stock Exchange listed company, a Fortune 500 company providing data and consulting services. Prior to that, he was a management consultant with Bain and Company, executive director for Pfizer Pharmaceuticals, and in the academic arena, he was an assistant professor of public health and medicine at Cornell University's Weill Cornell Medical College. While at Cornell, his research focused primarily on health economics and technology assessment, and he's published both original research and expert views in these areas. So without any further ado, Dr. Battleman, take it away.
Thanks so much, Joe, and thanks for that kind introduction. I couldn't have said it any better myself, so I appreciate that. I'd like to first welcome everybody here that's joining us today from Camaplan, and also a thanks to Camaplan for and to Joe for hosting us for this forum. For those of you that are able to join today, and this is actually also being recorded for those that have registered that will be watching this asynchronously. I just want to say, I think this is a really great forum and speaks volumes about Camaplan and its mission to really bring private placements to the Camaplan investor network, bringing benefits for all sorts of reasons. As I'm sure most people here know, if you were to look at any large fund, pension fund or otherwise, probably on average about 20% of their assets under management will be on or about private placements, and there are reasons for that. These are often deals that they have unique access to, that further diversify their portfolio. They provide some shielding from correlation with publicly traded equities markets, and so there are a lot of reasons why. And again, to Camaplan investors, I don't really need to emphasize the value of having access to private placements. And so we're delighted to be here and have a chance to speak with you guys about all this. And I should say that we really hope this can be sort of interactive and rather than me just sort of going through these slides, but we will definitely have a Q&A at the end. And but if anybody has questions in the interim, please raise your hand, and Joe Fulvio will certainly interject. But I guess I would also say, just as I'm finishing up here on this brief intro, is that I knowing a bit about Camaplan and the private placements that Camaplan investors typically look at, which I think at least the majority of these typical these forums are on real estate related transactions. Again, a real privilege for us to be here as a med tech company, but I want to underscore perhaps for the group here the value of thinking about an opportunity like this, because the investment thesis, the risk reward profile is different. And one of the things that I obviously everybody wants to focus on is the reward. This is an emerging growth company in the med tech space, and as we'll talk about later, can provide fairly substantial and fairly impressive returns relative to other asset classes, and so other types of companies. But obviously then everybody asks about the risk. And so one of the things that I really want everybody here to focus on as we go through this is what we like to think of as really distinctive about Biofuse is what we call sort of the asymmetric risk reward. You're going to hear a lot in this presentation about why we believe this is a de-risked opportunity in a later stage med tech device company with proven technology in human and significant human data that right now is being offered at a fairly inexpensive seed-based price. And so we'll get into all of those components here. But I guess for the value investors on the phone, which my guess is almost everybody, I am too, a Buffett groupie by heart. I really look at Biofuse through that lens, and I hope by the end of this discussion we'll be able to at least pique your interest, and at the very least end up having sort of a follow-on discussion with some or all of you about potential interest in Biofuse. So with that, let me. This is what our intro slide is. We're looking to reshape the frontier of surgical closure. That's what we're going to be talking today about: closing surgical wounds, surgical incisions, using an advanced, proven, and first in class. So really, what that translates to is no competition, and we can talk more about that, radio frequency multi-tissue platform. So I know that sounds like a mouthful, but hopefully by the time we're through, this will all resonate. So again, thank you all for being here. Chime in with any questions, and let's move forward. So here's our forward-looking statement that I'm not going to bore you with, but obviously for any investors, I would encourage you to read this and really just our disclaimers and necessary regulatory disclosures. Next slide. So here's our executive summary. And as I said, what we're looking to do and what Biofuse is doing is reshaping the future of surgery with a novel and highly disruptive radio frequency technology that will allow multi-tissue fusion. And this is really targeting the $2 billion suture and staple market. So let me just stop there for a second and unpack that a little bit. We're not looking to create a new market here. This $2 billion suture and staple market is the US. The global market's another 2 billion plus. It's a $4 billion global market. It is a very well-established market. We are not looking to plow the road here and create a new market. The market exists. So that is, for many device companies and any new medical technology, very often that's one of the biggest hurdles is, really just establishing a market. But this market is, it exists and it is robust. It's also concentrated. It is a market that's concentrated with two major players, J&J and Medtronic. They basically have a duopoly. And the other important piece at this headline is really there hasn't been much innovation in this space for 30 plus years. So we are really taking direct aim at this $2 billion US, $4 billion market that's controlled by two major players with what we believe is proven and highly disruptive novel technology to close surgical wounds. And we will further explain why this is such a unique technology and why at least many physicians, almost all surgeons that we speak to, describe the Biofuse solution as the holy grail to surgical closure. So just to go through these bullet points, innovative and disruptive, we'll unpack that in a little bit more detail and actually what the technology is. This next one is really for those that are not that familiar with life science or biotech or med tech investing, is really something that I would put a number of check boxes or circles around: proven clinical efficacy. So often, when you look at early, emerging growth companies in med tech, you're sort of taking a gamble. Will this work? Will it won't work? What do we know about it? Well, this technology has been used extensively outside the US, not in Europe, not in major Western countries, but has been used technology's origins are out of Battleman Institute in Ukraine. This technology actually has been used extensively in hundreds of cases and multiple types of surgeries in Ukraine. We have all of that data. It's been used in thousands of animal experiments in multiple settings. We have all of that data. And really what Biofuse's mission right now is to take this proven technology and really pull it through the Western regulatory and approval paths, which undoubtedly will include some human clinical trials in the US and Europe. We have a complete portfolio. So again, without getting into too much detail, when you think about surgical closure, there are three main devices that get used in surgical closure: a linear device, a long linear device, a circular device, and a laparoscopic device. We have prototypes for all three of those devices, and we have data to show that our technology works across the entire platform. And as we'll talk about later, very robust, revenue projections, targeting about 80 million in initial device sales by 2030. Though, as we'll talk about our exit plan, we fully anticipate being sold well before that. And our current exit plan is to bring these devices through regulatory approval and likely sell the company to a major acquirer. So that in a nutshell is our big picture on Biofuse. Let me just stop and see if anybody has any questions, or if anybody else from the Biofuse team here. Frank D'Amelio, one of our senior advisors, Scott Kemp, our Chief Operating Officer, Joe Stauffer, our fearless leader and chairman, serial med tech and pharmaceutical entrepreneur. Anybody have any comments or questions before we move on?
So I think you'll probably get into it, Dr. Battleman, but the FDA approval process and the approval processes in North America and in Europe are probably a mystery to most of the people listening. They certainly are to me. You may be covering this a little bit later on, but what will be the timeline? What are the milestones to look for?
Yeah.
In terms
So
of
yeah, we will cover it, and we have a whole slide later on the regulatory path. So maybe we can just put that, cover that there. We have an excellent regulatory advisor that we've been working with. We have a regulatory plan. We will be, part of the use of these proceeds will be for full engagement with the US FDA on validating our regulatory plan and getting some additional clarity on exactly what the regulatory requirements will be for this proven technology, how much credit we're going to get for the proven use of this outside of sort of the FDA purview, outside the US. But, just to answer the question at a very high level, our lead device, we anticipate to have 510(k) FDA clearance probably within the next 9 to 12 months. We're anticipating regulatory clearance for our more advanced systems in the 3-year time frame. So that's probably at the time frame when we be looking to start exploring discussions around exiting. Does that answer your question, Joe?
I believe that does, yes.
Okay, great.
Yeah, because you had mentioned this as some de-risked, and I think that's a big part of it is, surprises that might occur along the way to getting regulatory approval.
Absolutely. I mean, the thing is that and it's a good point. I mean, we will be getting further clarity from the FDA on exactly what they want from us in terms of regulatory clearance, but that's likely going to translate to an exact number of studies, patient cases they want in the US, the EMA in Europe, how many cases they want to prove this. But here's the key. We know that this technology works. We've hundreds of cases that have been done outside the US. So almost regardless of what the FDA hurdle is, we feel very confident that we're going to be able to successfully, avail ourselves of that hurdle. And so that's where we talk about our proven clinical efficacy and the de-risk nature of this. We know this technology works in multiple tissue settings. And so we are very confident that we'll be able to meet whatever requirements are put in front of us.
Thanks, Dr. Battleman. Appreciate that.
Great. Next slide. All right. So this is just really a snapshot of the multi-billion-dollar U.S. market. I've already made a reference to the fact that this area is very overdue for innovation and technical advancement. We believe that every surgery that cuts through soft tissue or blood vessels that currently requires either sealing, stapling, suturing is what we're calling biofusable. We're imagining a day where biofuse is a verb. Let's biofuse it. Tissues are biofusable. We are creating a new category here, and we're very excited about it. You can see some of the big numbers here in terms of the vessel sealing market being a multi-billion-dollar market, the suture and staple market, the procedures that are done in the U.S. And this market's growing year over year. Obviously, the major players, J&J and Medtronic, that own the duopoly here, are very content with the current state of the market. But I will tell you, and this really isn't the right forum to get into the clinical details of why the current state of play is inadequate. But let's just say that staples and sutures are non-continuous closure. You can imagine, if you were to think about taking a Ziploc bag and filling it with water and trying to seal it with staples, and then turning that Ziploc bag over, that bag is going to leak. If you try to sew it closed with a needle and thread, as good a job as you do with your needle and thread or suturing, that bag is going to leak, especially if you put some pressure against that seal. But as we all know, if you take a Ziploc bag and get a continuous closure and zip it closed and turn it upside down, that bag is going to hold the water really well. Now, when you're not talking about a Ziploc bag, but you're talking about tissues like your gut or your intestine or your lungs or your pancreas that all contain contents that really surgeons don't want to leak. That is why continuous closure is the holy grail of surgical closure. And in many surgical situations, particularly in GI, liver, pancreas, other areas, these lead to very significant rates of complication and cost, and to be honest, fear among surgeons and patients around tissue leak. And so this is really what Biofuse is all about: getting away from discontinuous closure and moving towards making every procedure biofusable to avoid that problem of tissue leak. So big market, big opportunity, very stale area that hasn't really seen innovation for a long time. And this really is what the slide that we're taking a big arrow and pointing at, that we're hoping to ultimately conquer. Next slide. So here's, here is, sort of an overview of our platform relative to other technologies that are out there, particularly staples, which are really sort of the mainstay of surgical closure. Unlike sort of a stapler that uses a physical barrier, we're using energy source. We're using radio frequency energy to actually seal the tissue. Without getting too technical here, we are doing in real time at the operative site what the body does over 10 to 14 days as it closes a wound. We are causing collagen cross-linking in real time intraoperatively. Collagen is the glue that holds your tissues together, and that cross-linking is what we're able to achieve in real time intraoperatively to get that continuous seal to actually accelerate what your body tries to do over 10 to 14 days post incision with a non-continuous closure using staples or sutures. It leads, as we've talked about, to leakage reduction. We can do this in multiple tissues, and we can do this with very little tissue damage, which is actually really the key to Biofuse's technology. Many companies have tried to do this in the past using energy sources to try to get tissue fusion. In fact, you look in the literature, there's a lot of literature about welding or sealing, and there are all sorts of, there's a whole gibberish around technology. But the problem here is to get the seal without causing damage to tissue has really been the stumbling block. And we have come up with our partners at the Institute of Battleman, the formula that we believe works. And it's a fairly complex formula, and we'll talk about that in a bit. But that really is the centerpiece of this multi-fusion tissue platform. Next slide.
Dave, there's a question I don't know if you want to handle questions now or later.
Yeah,
So,
no, I would love to handle questions now.
yeah, I think that one's from Jim. I'm going to let you guys do it. I don't want to micromanage this, but I just saw that come in here. So, Joe, if you could help him.
Yeah, no problem. So the first question, Jim is asking if there have been any trials. There have not been any trials conducted in the U.S. Is that correct?
That is correct. We have done extensive animal testing in the U.S. We have done extensive animal testing, but we have not done any U.S.-based trial yet. The seed funding that we're looking for, we're currently, and we'll get to this later, we're raising a $4.5 million seed, about 1.3, 1.4 of that's already been taken. This will be to not only advance our technology, but to move forward with our regulatory path and to really get us on the road to moving towards US-based US and European based data for Biofuse, but currently not in the US, though literally hundreds of multi-tissue fusion cases that have been done in Ukraine, which is where the technology has been pioneered, and we've been working with them over the last almost 10 years on co-developing this. We have those exclusive rights in US and Europe. I will also say, just parenthetically, for anybody that's interested, we actually have a flyer from our partners in Ukraine. This technology is being used on the battlefield right now. There's a portable unit using this technology in real time in the Ukraine, conflict situation. But yeah, no US trials, but extensive ex-US data. So, but thank you for the question. Any other questions, Joe, at this point?
Not at this point.
Okay, so I'm going to pass this over to Frank, who's our senior advisor related to product development and systems engineering. He's going to take you through really a little bit more granular description of the technology. We have a small video animation to help you see what's going on here. But what I would just refer back to as Frank is talking about this is just think back to the Ziploc bag analogy. Trying to get in real time a continuous seal on a tissue that often contains really vital contents that you don't want to leak because they'll be toxic or they'll cause any other kind of complications, an air leak in the lungs, or sepsis if your bowel leaks. So the Ziploc bag analogy is really very, very apt as Frank just takes you through the next couple of slides. And I also will just say, for those of you with weak constitutions, 1 or 2 slides are some a little bit bloody animal studies that really show what's going on. So after this slide, if you're not too inclined to see sort of an intraoperative demonstration or photo, you might want to just be aware of that. So Frank, let me hand it off to you. Thanks for joining, Frank.
Absolutely. So what I wanted to show here is what is multi-tissue fusion, and maybe picking up on what David has just talked about, that the sealing of a plastic bag. I'd say don't think so much about the Ziploc feature of it. Think more about those plastic bag sealers that exist that pull a vacuum, and then with heat, they actually seal the two sides together. So be thinking about what David said about trying to do this with staples or sutures, and you actually have interstitial spaces where fluid can leak out. But they have those heat sealers that seal a bag. Think along those lines. We do that kind of a function, but with RF. We're heating it up just the right amount to cause cross-linking without damaging the tissue. And very importantly, we're not putting any foreign objects into the body. So there's no metal and there's no suture to be rejected by the body. So let's show a short video on what it means to have tissue fusion. And I think Scott's going to lead that. So you see two pieces of tissue that are being brought together by an electrode. They're compressed, energy is applied, a little bit of cool steam is emitted, and you can see immediately it's sealed together. So again, any kind of an electrode, it could be circular, it could be linear, it could be laparoscopic. Energy is applied, a little bit of steam comes up. You see blanching, but not charring. Very important, didn't kill the tissue, it just cross-linked the tissue. Thank you, Scott. So that's a function of the generator that's used with all the algorithms that have been built into it that sense the tissue and adjust the output of the generator so you don't kill the tissue, you don't overheat it, you heat it up just the right amount very complicated equations are used on how to treat that tissue and how to cross-link it. And we do that as a result of the generator and the instrumentation. Very important on the instrumentation is that the instrumentation is mimicked. It looks exactly like a stapling device, but we just replaced the stapling device with electrodes. So the physicians know how to use it, how to hold it. It's just that the fusion technology is different. No more staples. It's RF fusion. Next one, Scott. No, next slide, please. So here's an example of kind of a composite here of a lot of different testing that's been done. So very common is, if you look at the bottom, is something called an end-to-end anastomosis. It's where you take out a section of the bowel, and it's oftentimes diseased or cancerous. You take that out. So think of a very floppy garden hose, or almost the casings on a sausage, but a lot thicker than that. And so you take out the section that is bad, and now you have to reconnect. So this is a standard stapling instrument that's been converted to a tissue fusion device. So the two ends go together on the left-hand side. They're pulled together. That's called approximation. They're pulled together and squeezed a little bit. Look on the bottom right-hand side, and you'll see that the fusion is complete. It looks almost like the video, a little bit of white blanching. And then weeks later, open it up, is up at the upper right, and you can see how it welded, fused all the way around the tissue. Next slide. So again, left-hand side, fused tissue. Very important slide here. Some ink was injected upstream of the intestine itself, just to see the blood crossing the boundary lines. Take a look at the bottom. you can see where it was fused, that very fine line just below the bottom white line. You can see how the blue dye crossed over. So that just reinforces that this was fused together. This was cross-linked, and blood can flow from one end to the other. So it didn't kill the tissue. If you kill tissue, you can't cross that boundary. Next slide. Right-hand side is the instrument that was used. It's very similar to the left. There's a conventional surgical stapler, which shoots staples much like what you see on a clock from 12 back again to 12. It shoots a bunch of staples in a circular fashion. Well, we do the same thing, but by fusing tissue together on the right-hand side and just connecting it to a generator. That same generator can be used to convert a conventional linear stapler into a multi-tissue fusion instrument, much like the video that you saw. And there's also laparoscopic instruments to the left. So it really just comes down to the smarts that's in the generator, the algorithms that are in the generator. Take normal instruments that doctors and physicians are used to using, take the staples out, put electrodes in, and now you have a continuous fusion of tissue without using staples and without suturing. That's really the presentation. Thank you, Dave.
Thanks, Frank. So great. That just shows the device plugging into the generator. Super. Any questions at this point? Well, we're just taking a pause to see if there are any questions. I'll just sort of say that I have to say that when I saw that slide that showed the blue dye and sort of the reperfusion following surgery, to me that was, you know, sort of the slide that convinced me that I wanted to be part of this company, and that this company had solved a problem that others have not been able to solve. You know, as we'll show in a minute, there are quotes from surgeons that have looked at this, but they look at these data, and very often the reactions I get are, how do you do that? Like, how is this possible? And so, you know, I want, you know, Frank was somewhat understated about that one slide showing the blood flow and revascularization, but really that is pretty miraculous following an energy induced tissue fusion process. So so thanks, Frank. Joe, any questions, or we're good?
Just a quick one. While we're on that previous slide, and while we were talking about in theater or in the operating theater application, it's a disruptive technology, but does it disrupt any other portion of the sort of incumbent practices and procedures, you know, the clinicians,
right?
The operating room
So
staff?
that's a great question. I mean, part of what again I love about this platform, and I think surgeons love about this platform, is, you know, if you were to show this slide that you're looking at right now to surgeons, these are all tools that they're very familiar using. They have the same form factor, they have the same you know, same look and feel, and are going to be, you know, very natural for them to use in place of you know, traditional staples, for example, and certainly more cumbersome sutures. So you know, our belief is that look, there are surgical applications that we have surgeons that want this now, because there are GI surgeons, liver surgeons, pancreas surgeons, lung surgeons that have major problems with discontinuous closure. And that's going to be sort of our high value, early market entry places, areas. But we believe that you know, over time, this will become the new standard of care. So it really has that ability to be disruptive and take such a basic thing like closing a surgical wound and bringing it into the 21st century, which really, as I said, has this area hasn't seen any innovation for 30 plus years. Next slide. So here's just a couple of peer-reviewed abstracts that have been put out that Biofuse has co-sponsored. We've covered a lot of the content here, so I don't want to reiterate around the extensive testing, the clinical success, the durability of healing, the reduced leakage rates, very significant, very important, and the enhanced strength and elasticity related to these collagen cross-linked continuous fused lesions. But these data are out there. We have them. We have the underlying cases to support this, and so we'll be looking to do more of this in the future to further document and promote the clinical utility and obvious commercial value of Biofuse technology. Next slide.
While we're just before you get on to the next slide, there is a question that's kind of germane to what you've been talking about right now, and that's Rosalind is asking, please address the strength, and forgive me for mispronouncing this, of the anastomosis versus staples or sutures strength.
It's great. That's a great question. Maybe I'll hand that to Frank as sort of our lead product design and engineer. But what I will say is that our data suggests that the strength is significantly. The strength is intact and significantly reduces leakage rates. But Frank, do you want to comment on that?
Unfortunately, Frank had to drop off, but yes, we did have tensile strength tests that indicate that the strength of the weld is as strong at the point of the procedure operationally as it is stronger than the native tissue. And we have some burst videos that show that once at the point of the anastomosis, the intestine is then inflated with water, and the weld fails at a site outside of the weld site. So the weld is stronger than native tissue and certainly stronger than staples.
Thanks, Scott, and
Thanks, Scott.
I appreciated that, Rosalind. I hope that answered your question.
And apologies, I didn't see that Frank stepped off, but I knew he had a family urgency, so we really appreciate that he was even able to join us for when he did. These are just a couple of quotes from some of our advisory board members. Dr. John Munson, he's the former chair of the UK's National Colorectal Surgical Training Program. Dr. Neil Hyman, also senior advisor and co-director of Center for Digestive Disease and Colorectal Surgery at Chicago. Two very prominent, very well-known surgeons. Really just singing the praises of Biofuse technology, its need in the operative room, as per Dr. Munson, and Dr. Hyman really talking about its use in multiple settings, and they're big supporters and heavily involved in the company alongside many of their colleagues. Next slide. So this is that slide we were talking about with respect to our initial de-risk regulatory pathway for our first generation device, which will actually be focusing purely on vascular sealing. We actually have a first generation device that's already been FDA approved, FDA cleared. We have a second generation device that we believe is significantly better, using the most current multi-tissue welding algorithm and technology that we're moving towards FDA clearance. This is the path for that. We anticipate that following the closing of the Series C, that this is about a 9-month path to get this vascular sealer approved, and then ultimately another 2 to 2.5 years to get our first next generation device, being the circular welder, the circular fusion device for gastrointestinal surgery, approved. Next slide. So, really, what's at the, what are you buying, right? What are you buying? Why are you interested here and potentially interested in in Biofuse? Well, this slide really sums up what we have. We've got the exclusive global rights to this proprietary technology in the U.S. and Europe and parts of Asia for the use and commercialization of this, which obviously presents a significant barrier to entry. You know, decades and thousands of hours of trade secrets into the engineering of this technology. Both the generator and the handheld piece will have defensive software design, so essentially unhackable. Anybody that tries to, you know, enter into sort of the device, whether it be the generator or the handheld, the chip design is such that it will, you know, essentially self-destruct. So again, that technology is secured within the device and the generator. We have a strategy for extending our global IP based on some of the more recent innovation that has come through the collaboration of Biofuse with its partner in the Institute of Battleman in Ukraine. And as I alluded to, we're thinking about some added features for enhanced device security, even beyond just the chip security. So what we really have is a multi-layered offensive and defensive game plan to ensure the protection of this proprietary technology to Biofuse and really to the Biofuse platform. To our knowledge, there really is no one else out there that has anything even close to this. We know J&J has tried. We know Medtronic has tried and failed. I just had a meeting with a former Medtronic exec who was very involved in their program to use energy enhanced staples to enhance tissue closure. They were essentially blown away by what we've done here. I think that we really have a lot of white space and room to run. So next slide. This really just talks about sort of our initial programmatic activity for our vascular fusion device, which will be our first device in the market. I'm going to skip over this in the interest of time, but we have a group of active vascular surgeons and other surgeons that want to both pilot test and help us roll out this first generation device, which, as I said, should be FDA cleared within the next 9 months following the closing of the seed round. Next slide. The next two slides are a little bit of a teaser for those that want more information. This is our commercialization timeline. Obviously, we've got a detailed commercial plan. We'd be happy to share it with anybody under NDA. Next slide. Likewise, we have a very robust interactive financial model, 5-year financial projection that we believe is very conservative. And again, happy to share this with anybody, anybody that's interested under NDA. We have a full data room, and we'd be happy to take you through all of our inputs and assumptions, and obviously even share the model so people can make their own changes and modifications. So we have all of this information and would be delighted to go through with all of you under NDA. Next slide. This is an important slide. So this is, we didn't really show you our commercial plan. We didn't show you our financial model, but here's some of the output that I think is really about sort of the payday. If you were to look at our financial projection and look at a net present value calculation, which we're showing at the top of the slide at about 22 million, that's using number one, a conservative financial model. So we think that that model could probably be substantially increased based on more either realistic or aggressive assumptions. But using that conservative projection, and even on top of that conservative projection, a 50% equity price premium we get or essentially an equity risk premium, a 50% risk premium. Our net present value is about 22 million. So on a conservative projection with a 50% discount related to an equity risk premium, we come up with a present value of 22 million. And we're raising money right now as you'll see on a subsequent slide, at 15 million. So there's a 34% discount built into our intrinsic financial model alone. So again, for a value investor, I think that probably is compelling. What might be more compelling is if you look below, we've taken our conservative financial model, ran it against some sales multiples. So if you look at the mid case of let's say a 12x sales multiple, that would look at a terminal value of about $250 million, a multiple on investment capital based on our model and required capital investment of about 7x. In our more aggressive case, you can see that the multiple on investment capital can get pretty lofty, again, off of this conservative projection, pushing upwards of 18 to 20. What's really interesting here is if you look at our mid-case projection at 274 million terminal value, and you look below at some of the comps that are in the marketplace, you can see that they range from 160 to 400 million at sales multiples that range from 13 to 30 some odd. So you could see that our numbers are very well within the range of these comps. But the really important thing to know about these comps that you're seeing here are these comps from Ethicon and OmniGuide and Hologic, big players. They are for acquisitions related. These are for acquisitions related to devices that only do vessel sealing. Our first generation device. We have a portfolio that goes well beyond vessel sealing, multi-tissue platform, circular, linear, laparoscopic. These acquisitions, these comps here don't even come anywhere close to representing the value in the Biofuse portfolio. So again, hopefully that piques some interest in what the potential is here for Biofuse based on our conservative assumption, our heavily discounted equity risk premium, and benchmarked against 3 very relevant comps, despite the fact that these comps are purely based on acquisitions of vascular sealing without sort of the multi-tissue element that Biofuse brings to the market. So let's just go on, and then we'll just have a few minutes for questions. Again, this is a quick slide just about showing that the medtech medical device space, there's a lot of activity in the M&A space, a lot of mergers and acquisitions. If you look at the trends in medical device in 2024 and beyond, by far the #1 trend in the medical device industry is consolidation. So in that way, we think the wind is in our sails, and we believe that our exit strategy at looking at 3 to 3.5, possibly 4 years is very realistic. Next slide. This is just a brief overview of our all-star team. I'm obviously Dave Battleman. You've heard from Frank D'Amelio. Albert Juergens is our Chief Technology Officer. Both Frank and Albert have extensive experience in medical device development and commercialization. Mike Adler's our Vice President of Business Development, and also extremely accomplished and well-credentialed in medical device space. Next slide shows our board, led by our fearless leader, Joe Stauffer. And we've got Ernie Stern, who's our board member and outstanding legal counsel, and several other med tech entrepreneurs and industry leaders that really have provided a lot of commitment and support to the company over the years. Next slide. So here's the offering. We've talked about this, but the current open offering is 4.5 million of common stock with a pre-money of 15 million. So we're selling about 20% of the company, a little bit more than 20% of the company. I'm sorry, a little under 20% of the company, given the current offering. And here's sort of our 12-month use of proceeds related to things that we've already talked about around finalizing our lead product and establishing our US-based manufacturing facility, expanding our supply chain, working significantly on regulatory and IP milestones, building our US team, and developing additional and next generation prototypes for our portfolio. Next slide. This is our last slide that basically sums it up. So we've talked about our radio frequency technology, the proven efficacy, the strong path for our IP portfolio based on some of the new innovation in the company that we look to patent. Very robust revenue projections, and really most importantly, what we believe is just transformational innovation in the surgical closure space. So with that, we would invite anybody to join us on this journey and learn more about Biofuse, and we would love to potentially extend our investment base to any of the folks here at Camaplan or elsewhere. So I see we've got about 5 minutes, and so I was hoping to have a little bit more time, but let's open it up to some questions.
Yeah, let's do that. You covered a pretty clear path to exit. There's a lot of examples, and you've got a timeline there. And my only question is, what if no acquisition occurs? Do you positioned to fully go to market, support the product in the field, engage the clinicians and reach the surgeons and proselytize and convert them?
Yeah, absolutely. So we're fully prepared to go this alone. And build out a manufacturing, distribution, and sales team network. I think in my experience, that would be an unlikely path. I think we would likely, if we're not looking at an acquisition by a major manufacturer, which I think is our most likely path, we would probably be partnering with a company that might have sort of an established distribution and sales team in an adjacent area, particularly other surgical supply areas. But we're fully prepared to build this out alone. In fact, our model projects our initial commercialization, sales, distribution effort. But I'm fairly confident that the company will be acquired before that point. But obviously a fair question, and certainly something we're prepared to tackle and deal with.
Good to know. Good to know. Thank you. And then just to recap the offering itself for participation in terms of minimums and hold periods and whatnot. Scott, do you want to address that as a close?
Sure. The minimum investment is $50,000. The share price is 86 cents per share of Biofuse common stock. As David mentioned, it's a pre-money value of $15 million. And we have taken half units for some investors that want to get some exposure to the company and then step in at a large amount. I would say that many of our investors are surgeons or in the medical profession. And we look forward to your questions. And if there's further interest, we would like to invite you to have a conversation one-on-one with us or get you into the data room with an NDA.
Good. And yeah, there's contact information. I think, do you have a final slide with contact information in case anybody wants to grab that now? Beautiful. Perfect.
And I think Joe, we'll be getting everybody's information. So at least email. So we'll certainly be sending a follow-up and inviting further discussions. And again, we'd welcome anybody on this call, if there are others that you think might be interested in Biofuse, we'd welcome those introductions as well. And we'd love to hear from you. We're pretty excited about the journey. As I said, the feedback from the surgical community is pretty humbling and inspiring, and would love to share this with Camaplan and Camaplan Network to the extent there's interest. So thank you very much.
Thank you very much, and thanks to the Biofuse team for showing up and giving us a good look at this thing. Thanks
Perfect.
everybody. Again, this
Thank
has
you.
been a special edition of the Camaplan webinar. We'll see you next time.
Great. Thank you.